I'm Dr. Fackrell. Welcome to Health Corner. Tonight I'm going to talk about colic and newborn babies. I do take care of a lot of babies in my practice, and I really enjoy that part of it. But a lot of mothers come to me asking, when my baby's crying, how do I know when it's serious, or when it's something that they just need to be fed, or the diaper changed, or comforted. So tonight we're going to talk about the difference between just the normal crying and then colic, and treatments and things that we can do. Now, colic is an excessive amount of crying, and it's something we'll talk about now. And this is Jessie, and she is a PA who's been working with me in the past, and she's going to discuss it. Thank you.
Hello, my name is Jessie. I'm a PA student, as Dr. Fackrell mentioned, and today I'll be talking with you further about colic with newborns. Oftentimes, you have that newborn baby, and they just cry and cry and cry, and they're a little irritable. And this can be very stressful on moms and dads, because number one, your baby's crying, and you may think, oh, what is wrong? And you maybe even will blame yourself. But I just want you to know this is not your fault, that this is a very common thing. It's actually one of the most common health problems with babies, if you can classify it as a health problem. They haven't been able to figure out really what is causing the colic, but there are many techniques you can do to help your baby not cry as much, and to also help you handle these stressful times. These colicky episodes usually occur around 1 to 2 weeks of age, and they often just all of a sudden go away at around 16 weeks of age. Remember, every child is different. They may start earlier, they may start later, they may end earlier or end later, so it totally just depends on the child, and every child's different. So what happens during this colicky episode, as we call it? Well, your baby cries, and it may be loud, and it may be a persistent cry that you can't really comfort or console them, or it seems that you cannot help comfort or console them. Also, you may find that your baby is flexing at the hip and bringing their knees up to their stomach. They may be doing this during these crying episodes. Also, there's a rule of 3 that we like to talk about in medicine when it comes to colic, and this rule goes as follows. Colic happens at least 3 months of age. The baby is 3 months of age, maybe younger than that, but the crying goes on for at least 3 hours a day, for at least 3 days per week, and for at least 3 weeks total this goes on. If your baby has all of those things, then it's most likely colic. But today we're going to talk about maybe some other things to look for, and things that will help relieve your mind or put you at ease into knowing that maybe it really is colic and not something really serious. First, I want you to remember that eventually they do grow out of this. So just keep that in mind when the nights are long and you're not getting very much sleep. First, I'm sure you want to make sure that it really is colic and not something more serious. So I'm going to go over some things that could possibly be making your baby cry. Some of these are emergencies, and others are not quite emergencies, but a little more serious. The first condition I'd like to talk about that may be causing your baby some irritation or cause them to be crying is constipation. I think we all know what constipation is. It's just the passage of dry, hard stools. Breastfed babies have been shown that they actually have more bowel movements, or they poop more, than just bottle-fed babies. Formula or bottle-fed babies tend to have stools anywhere from 1 every 3 days to 5 times a day. So it's important for you to get to know your baby's habits and what typically is normal for them. And then maybe if you've noticed they haven't passed a stool in a while, that could be causing their discomfort. They oftentimes will drop their knees to their stomach. Their stomach may be distended, and that just means that their stomach may be bloated a little bit more than normal. Another thing that constipation may actually cause is an anal fissure or a crack. And this just means that there's a crack in the skin after they pass a large hard stool. It can actually cause bleeding even. And it's not an emergency by any means, but it's important to check these things when you're changing your infant's diaper. One thing to know too is that if your baby tends to be more constipated, they have a greater chance of developing urinary tract infections. And one thing that can help relieve this constipation is you can get a dropper full of prune juice and drop that into your baby's mouth, and the prune juice helps move everything right along. The next thing that may be causing your baby some discomfort and crying is pinworms. Pinworms is actually caused by a nematode, and with a fancy name that I won't mention, but this nematode actually emerges at night into the perianal area, so around their little bumhole. And the eggs actually cause irritation and itching, which may be a big common cause of nocturnal crying, and that just means more crying at night. If you suspect this, one thing to look for is look when you're changing your baby's diaper for little thread-like strings that may be around the anus, the anal area. Again, if you have any questions about this or you suspect this in your baby, go see your healthcare provider and talk to them. They'll be able to direct you further. Another common cause of infant distress is otitis media, which just means it's a middle ear infection, and fluid actually builds up in the middle ear of your baby or your infant even. They will have a fever present. They may pull at whatever ear hurts them, and that may be a sign to you that, whoa, they've got a fever, they are pulling at their ear, they may have an ear infection. A lot of times they'll have nausea, vomiting, diarrhea with it even. Remember, if you suspect this, to bring them into your doctor or your PA, and they'll be able to help you and get them on an appropriate antibiotic. Sepsis is the next thing I would like to discuss. Sepsis just means a really bad infection. Now, if your baby is less than a year old and they have a fever, they're maybe more lethargic than normal or more tired or just kind of limp as a noodle, and plus the fever, you may suspect this and be nervous of it. If they have a temperature over 100 degrees and they are less than 1 year old, you need to take them to the emergency department or immediately see your family doctor if you can get in, because they need to rule this out. It is an emergency and can turn really ugly really fast. The next thing that's important to consider is a food irritation or allergy. Usually these crop up or pop up in the first 6 months of life, usually about 6 months or older actually. Usually they'll only affect one organ system, so in other words, they may have irritation to the throat and have problems breathing. They may have some skin manifestations, so they may have hives on their skin, or maybe a rash develops. They may have problems with their tummy. They may have diarrhea or cramping of their stomach that may be causing them some irritation, and obviously they would cry because of that. So all of these things you need to consider, especially if these symptoms or this crying or colic comes about after they've been fed. Hair tourniquets is the next topic I'd like to discuss that may be causing your infant to cry more. You may think, what in the world is that? Well, this happens when a piece of hair from the adult, obviously, from someone in the house, or maybe a dog, who knows, becomes wrapped around either a finger or a toe, or maybe even the penis on little boys. And this becomes wrapped around so tightly that it causes pain and it hurts. This can be noticed just by checking your baby from head to toe and seeing if you can find a discolored digit. If you discover this, make sure to remove it immediately and see if that helps your baby at all. Again, this would be a cause of excessive crying, especially inconsolable. You can't rock them, you can't calm them down, they just keep crying. Intussusception is another thing that may be causing your infant severe distress. This is a medical emergency, and you need to immediately go to either a pediatric emergency room, or be seen by a pediatric surgeon, or go to the ER and get help for your baby. What happens with an intussusception is one section of the intestine becomes like it's growing into another. This is kind of hard for me to explain. I'll go ahead and show you a picture so you can understand what I'm trying to explain. Intussusception is more commonly seen in a little older age infants, for anywhere from 6 months to 18 months of age. What will happen is it's abrupt onset of symptoms. So abruptly, they all of a sudden are really upset. They cry. They may drop their knees to their stomach. You may be even able to touch and feel in their stomach area and find that you feel a sausage-shaped mass. Is often how they describe what an intussusception feels like. After these periods of crying, there may be periods followed by where your baby appears lethargic or weak or tired. Along with the lethargy, the palpation of this sausage-shaped mass in their little tummies, they may even pass what we call red gelatinous stools. So they're gelatinous as in they look like jelly stools. This is an emergency, and again, if you have any or have noticed any of these symptoms with your baby, the abrupt onset colic or colicky crying, followed by the lethargy or periods of where they're just not themselves, along with the mass, along with the passage of the red gelatinous stools, you need to immediately take them to the emergency department and have them seen by a doctor or PA. An incarcerated hernia is another emergent condition. Incarcerated hernias are hernias that you can't push back in. So in other words, it's this hernia, this protrusion from the abdominal wall that you can't push back in. This can cause blockage of the stool and a lot of big problems. So you need to make sure that if you've noticed this with your baby, it could be up here in the lower abdomen. It could also be in the testicle that you could notice this. But if you notice this, you need to make sure and go to the emergency department, and an emergent surgery will have to happen to prevent complications with your baby. This hernia may be tender. You may notice swelling either right here in the inguinal area or in the testicle itself. It may be swollen and again very tender, and maybe appear red, and the skin may be red. So again, it's an emergency. You'll need to seek help if you find this with your baby. Testicular torsion is the next emergency situation that may be going on with your baby. This specifically is with the testicle, so you want to take off the diaper and look and see what you find. A testicular torsion is just a really painful, swollen testicle. And what happens is the testicle actually the spermatic cord that comes down that has all of the vessels that help supply the testicle with blood and keep it alive, twist. Now this means that there's no more blood getting to the testicle, and the testicle can actually die, or necrose as we call it, and you can't ever get that back. So this is another emergency condition. Emergency surgery needs to happen to prevent that testicle from dying. This will also cause severe, sudden abdominal pain with your baby. So you need to be just diligent, open that diaper up, look for testicular torsion or that testicle being swollen, and if you see that, take them in immediately for the help that they need. I think a good practice to keep in mind is if you have a baby that's really upset and crying, it's a good idea to examine them from head to toe. Take their diaper off, look at everything, and really do a good thorough examination. And if you have any questions, like I mentioned before, feel free to contact someone for help. And remember, listen to that mother's intuition that you have, or that father's intuition, because you may be right in that something is going on with your baby or something is not quite right with them. Now that I've mentioned all these scary emergency things, I'd like to discuss some things you can do with your baby when they do have colic. First of all, take your baby's temperature. A colicky baby will not have a fever, so that's one thing to keep in mind always. And then I would also like to just list some things you can do with that colicky baby that may help them be a little more relieved and help stop their crying and help you be able to handle the stress of that situation also. First thing you can do that I'd like to talk about with your baby is feed your baby slowly and burp them frequently. This can help decrease the amount of gas that develops in their stomach. As you can imagine, gas becomes a little discomforting to them because of all this extra air that's swallowed when they eat fast or when they aren't burped correctly or frequently. So you want to make sure to do these things. Signs that you may be feeding them too fast include increasing colic or crying, as well as spitting up. They might spit up a lot more than is normal for them. The second thing I'd like to talk about is that breastfed infants actually can taste and experience some of what the different foods their mom is eating. So try not to eat spicy things if that's what's contributing to your baby's colic. Try not to eat foods such as onions or cabbage or broccoli or dry beans, which can increase the amount of gas in your baby's tummy and aggravate that colic situation. One thing that may help your infant is to decrease the amount of stimulation that they are getting. And what this means is maybe passing them around from people to people stimulates them too much, or maybe a loud, noisy room might stimulate them too much and kind of upset them. One thing to reduce this is to swaddle them. And you're taught this in the hospital when you have your babies, but you just wrap them up real good in that blanket, make a little burrito baby, and that will help decrease the amount of self-stimulation while they're trying to fall asleep. Oftentimes you've seen babies do this where they fall asleep and they may jerk themselves awake, and that may upset them. So that's something to try. Another thing to try is the baby holders, the little carriers that provides contact with you and the baby. Sometimes that's very soothing for a baby. They just need to feel close to someone. Another thing that may work is putting them in a car seat or putting them in their bed and just letting them be alone for a second. That might help them, It's just specific to your child. You need to pay attention maybe to what helps your baby more. The fourth thing that may help your baby with the colic is take them for a car ride. The movement and the vibration of the car actually might soothe them and help them go to sleep. The fifth thing that you can do is put the baby in a baby swing for 20 minutes, and see if the movement from the swing can help soothe that baby and help them relax and go to sleep. The sixth thing you can do is walk or rock the baby with a little bit of pressure on their stomach. The pressure may help relieve whatever discomfort they have in their stomach and may reduce the crying. The seventh thing that may work is gentle massage. Have the baby lying down and help massage their back or massage their little tummy and see if that helps calm them down. An eighth thing maybe to try is to supply some background noise. Now this could be like white noise on a TV or a hairdryer or a vacuum or a washing machine. Or even some people I've heard have recorded a mother's heartbeat and play it to help soothe their baby. Place the baby in a dark room that has no stimulus. I know my mom was telling me about my sister. My sister, I guess, was kind of a colicky baby and she'd get upset. But my mom said that she figured out how to keep her from getting so upset, and that was to put her in her car seat if they were out somewhere, or put her in her room and have it be dark and quiet. And eventually, within a short period of time, she was okay again, and she was sleeping even. You may want to try a warm washcloth on the baby's abdomen. This may comfort the baby enough and help them relax a little bit. Another thing you need to remember is to not smoke around the baby and to not smoke while you're breastfeeding. This will increase your baby's amount or chance of having colic. So if you quit those things, then your baby might get a little bit better and not have these colic episodes as frequently. And obviously, you should never shake your baby, no matter how frustrated you are. If you're frustrated, remember, put them in a swing for a little bit and go take a break. Leave the room for just a short amount of time, 5-10 minutes, so you can gain your composure again. Or if someone's there with you, have them watch the baby and get out for just 15 or whatever amount of time, small amount of time that you need to help yourself gain composure again and not become so frustrated. Another thing that may help you or help your baby is simethicone drops. Simethicone is seen in Little Tummies or similar brands like that. That ingredient sometimes may be able to help reduce the amount of gas in your baby's tummy. The trials on this, I did the research on it, and the trials have shown low evidence that this does actually help with colic, but it may be worth a try, and there are no adverse side effects, so it's not going to hurt your baby to try it. Another thing that you can do is use whey alternative. Whey protein may be a little easier on your baby's tummy as opposed to soy protein or another type of protein that's in your formula if you're formula feeding your baby. Another thing that may be helpful is herbal tea. One randomized controlled study that I found that with low evidence that herbal tea with chamomile or vervain or licorice actually did help reduce some of the baby's infants or symptoms of colic. Now again, this is a low evidence, so it's kind of like the simethicone drops. It may work, it may not, but there are no adverse side effects with the herbal tea as well. A promising study I found that looked at probiotics with infants aged 3 to 24 months of age found that probiotics actually did decrease the amount of colic seen in babies, and consequently, another thing it helped out with is it reduced the amount of upper respiratory infections or colds that infants from 3 to 24 months got, as well as it decreased the amount of antibiotics needed by these specific infants too. The specific probiotics that these trials used was B. lactum and S. thermophilus. They also found that these were well tolerated by the infants and there were no adverse side effects. Finally, remember, no one is to blame. Colic is a very common thing. Many babies experience this and many parents experience this and survive it. Remember, it goes away, usually at 16 weeks of age. It may be a little longer, it may be a little shorter than that, but it does go away. Remember, if you have any questions, contact either a physician or a PA, and we'll be able to help you out, especially in determining if an emergency is at hand. Another thing that's really good to do is to talk to other parents. Talk to other people that are going through the same thing as you. It's very helpful. There are also some carrying techniques that I'd like to include that have been shown that may help soothe your crying infant. And I'll include those right now so you can see. I hope this video has been helpful and that you can figure out how to soothe that crying infant. And again, if any emergencies crop up, please don't hesitate. Come see us. We're here for you.